Ever wonder how we find cavities? Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care. Thank you for joining us today for Dental Hygiene Wednesday, where we like to give our patients and our viewers some nice tips and topics to cover. That way they have information and tools to help keep their mouths nice and healthy. 2 weeks ago, we talked about blood pressure and why we take blood pressure here at Dublin Dental Care and the importance of what it has and how it can affect your dental treatments. If you missed that video, feel free to check it out on our Facebook page. It is still up for you to view. This week we are going to discuss the Diagnodent. This is a useful instrument that we use here at Dublin Dental Care to help us detect cavities when they start to form on the biting surfaces of our teeth. This is Stephanie. Some of you may have seen her. She is the other hygienist here at Dublin Dental Care. We love her here. She is our lucky model today, so I'll show you how the Diagnodent works on Stephanie. So we always start by getting the Diagnodent matched up to your teeth, in the enamel on your teeth. And then what we do is we just take this little laser tip and we scan the top surfaces of the teeth. And Stephanie has sealants on her teeth, so that is what is setting that off in those areas. And we just scan all the little grooves on the surfaces of the teeth. If there is an area, I'll go to one where she has a sealant, it will go up and you'll hear a higher buzz or beeping. And that's an area that we'll write down and have Dr. Pignano check. But this is nice because it helps in several ways. It helps us by letting us detect cavities when they're just starting to form. So what this does is it reads the enamel on the tooth. And if there's a part where the enamel is starting to break down a little bit or a small cavity starting to form, then it will make that loud beeping noise that you heard, and it lets us know that's an area that we need to have Dr. Pignano check. If he goes through and he checks, there's several options he can do. He can either put a monitor on it if he feels like it's just starting and it doesn't need to be treated yet, and that way next time you come in we can check it and make sure that it's still the same as it was and it's not getting worse. Or if it's just beginning, not that far along, there's not really decay in the tooth yet, then he is probably going to suggest to put a sealant on, which is nice because it's cheaper than a filling. And it is, I've talked about it before, it just goes through and fills in the grooves, so that way the bacteria can't sit in there and cause more damage to the enamel. And then the third option is doing a filling. If there is an actual cavity that's starting to form, it's going to be small, and we will go in and we will get that taken care of. And the nice part about that is we're catching it so early on that it's normally just one surface, and a lot of times you don't even have to be numb for the procedure, which is awesome. So we are glad that we have this. It helps us out, and we hope that you come in and see us and we can use it on your teeth. Thank you for joining us. Check out our webpage. It's dublindentalcareohio.com, and if you have any questions for me, my email is christina@dublindentalcareohio.com. Thank you. Have a good day. Hey guys, just want to remind you of our awesome giveaway we're doing this quarter. It is called Fly Away With Us in 2017, Escape the Cold. So what we're doing here is when you come and visit us, you're going to receive one of these nice, cool stress relief airplanes. But what we're doing is for every referral you give our office, we'll put your name in a drawing, and at the end of March we draw one lucky person's name and they get a $750 voucher to fly Southwestern wherever they'd like. Send your referrals and hopefully you can win this awesome prize. Thank you.